Did you know that Northern Ireland is the only part of the UK that doesn't currently have a specific policy agenda regarding mental health? A draft study was due to finally be put forward, but with no government minister to sign it off or release the funding, it remained in limbo. In March 2019, there were 120,000 people waiting more than a year for an appointment with a mental health care professional in Northern Ireland. In England and Wales, this number combined was a much lower 5,000. The equivalent of 1 in 16 people in Northern Ireland has been waiting more than a year, compared to at most 1 in 750 in Wales and 1 in 48,000 in England. To put it into perspective, this means that a citizen of Northern Ireland is more than 3,000 times as likely as a citizen of England to have been waiting more than 1 year for healthcare. However, now that our executive is finally back up and running after 3 years out of action, Health Minister Robin Swann has said a mental health action plan will be published, providing a foundation for a mental health strategy before the end of 2020. He revealed this on Thursday past when he met in North Belfast with family members of people who have lost their lives through suicide. Zeki Kucok-Kosi is a 24-year-old software engineer whose brother committed suicide around this time 3 years ago. He's currently using his skills to develop a suicide prevention app in memory of his brother Ozzy. I met with him to discuss the Health Minister's new plans and to also find out whether he thought it was too little, too late.
Yeah, so I think it's positive that at least there's the acknowledgement that actually we have a problem and we need to do something about it. But unfortunately, we've lost a lot of time by the executive not being around for such a long time, and it almost feels like a little too late in a way. It's good that we're addressing the problem, but the World Health Organization back in 2013 got all of its participating countries to sign up to this idea that they would reduce the rate of suicide by 10% by 2020. And we're in 2020 now, and now the Northern Ireland Executive is saying, actually, we're going to reduce it by 10% by 2024. So we've already let the ball drop. We're 4 years late. So we're fighting an uphill battle from the start. I think it's a good idea that now we're actually getting around to the point and saying, yes, we have a problem, and it's good that we acknowledge that. However, we have a lot of work to go in terms of waiting lists for people in Northern Ireland. The length of time and the number of people who are waiting for up to 12 months at a time to see a mental health professional is shocking. It's outrageous compared to the rest of the UK. I have a friend the other day who was at the doctor and required medical evidence for extenuating circumstances for their exams, and the doctor said that you'll need to speak to a psychiatrist, and the doctor then informed her that, well, it'll be 12 months before you see a psychiatrist, and her exams are in 6 months. And so there's a bit of a disconnect there. There's clearly people aren't receiving the treatment at the time when they need it, and they're getting worse. 12 months is clearly too long for someone to wait. So what we need is an increase in funding, essentially. It's been stated by the Northern Ireland Executive that the average cost of a suicide to the Northern Ireland economy is £1.55 million. So clearly this is having a huge impact not only on people's personal lives, from the people who suffer from the loss of this person, but also on the wider economy. It's a huge drain to our economy, and we're losing lots of talented young people who can contribute to the economy throughout their life. So yes, it's positive that we're acknowledging that we have a problem, but there's definitely still a lot to be done rather than just talking about it. I'm developing a suicide prevention app. So the idea of the app is that it's to be the first line of intervention for someone who's contemplating suicide. So the idea is that whenever someone is at a time in their life where they're maybe not doing so well mentally wise, they might be thinking of taking their own life, but they might not be thinking of doing it right at this moment, but they know that this may be something that might impact them in the future. And so the idea is that we help guide them through to create a suicide action plan. So what that means is this is a plan which they would follow in the event that they are thinking of taking their own life.
Do you think it's a case as well with you making the app, obviously because that's where your talents lie in software development, but do you think it's a case where a lot of younger people in Northern Ireland now are just taking matters into their own hands, like yourself?
Yeah, I would agree with that. There's definitely a grassroots movement in Northern Ireland amongst the young community. I mean, I'm 24 now, if I think back to whenever I was 16, mental health and depression and these words, they weren't even in my vocabulary. I didn't know about them. It wasn't like that at all. But now if you speak to the younger generation, it's something that is much more on their radar, and they almost as if though they look out for each other. And especially with the inception of social media, all you see on Facebook and social media from people of my generation are people trying to raise awareness of these issues and people coming forward and talking about their own experiences. So I would definitely agree that people are taking matters into their own hands to try and supplement the lack of care that they've been given from the NHS in Northern Ireland. Now, that's not to say that the people who work in the institutions that are set up in this country aren't doing an amazing job. The problem is that there's just not enough of them, and it's unfair to expect them to try and do more than they physically can. So I would agree that people are taking matters into their own hands. Yeah.
CAMHS, or Child and Adolescent Mental Health Services, is the service that provides assessment and treatment for young people and their families who are experiencing mental health difficulties. I spoke with Niamh Galway, who herself came through the CAMHS system and is a strong mental health advocate today. The PSNI revealed last year that on average per week they received 400 mental health related calls. A survey came out around the same time showing that 78% of students living in Northern Ireland will suffer from a mental health related illness at some stage during their studies. Niamh discussed why she thinks the number is so high, with a particular focus on young people's mental health.
CAMHS for me, I was only seen I think 2 or 3 times in the year that I was with them by different counsellors at each time. So that meant nobody got to know who I was, what my problems were, what we needed to talk about. There was no plan for me on how to get better and stuff. It was put into my hands like have you tried, mindfulness? That isn't helpful if you're in a crisis point, and I was told by my last CAMHS counsellor, she was actually, I would have said, the best that I had, that she wasn't referring me to adult mental health because she said, if you think the services here are bad, you should see the adult ones. Well, I mean, people are a lot more willing to talk about it now, and I think it's so important that people do break the stigma behind, mental health issues and not mentally ill health. It's so important. But Northern Ireland, it's a real microcosm for misery, I think. We have an inherently classist issue over here where we have a very divided society and both sides have been left fester in poverty, and that breeds poor mental health. You look at our young working class men and women and you see them struggling, and we do have extremely high poverty rates over here, which is, I would say, a massive issue in terms of affecting our mental health. But I also think because we are a society that has grown from trauma and has went through crisis and basically been a war zone for so long, there is like almost I would describe it as like a snowballing effect or like a tumbleweed effect, that the mental health issues do derive from that as well, that trauma that our society's been through too.
What do you think of the government's promise for a new mental health action plan? What do you think it should look like? And do you think it's a little too late? We'd love to hear your thoughts. This is Niamh Campbell for Blast FM.